Today's topic is going to be an overview of Kratom. This was one of the suggestions that we had gotten when we asked for one of the brainstorming sessions. Interesting, I had done a topic on Kratom. It had come up in our substance use disorder echo several years ago, and I dug that out, and I was kind of disappointed that it was a hot topic then, and the amount of progress that we have made is not anywhere near what I was hoping it would be over the course of time. So we'll take a peek at what's going on with this. My objectives for today, we're going to talk about the active components of Kratom. So what do they do? How do they work? What might they be used for? Officially, this is not a drug substance. This is not a dietary supplement. It's falling in this weird kind of category right now. So everything I'm talking about is off-label. There are no approved indications, but we're going to talk about what people have been using it for and what type of adverse effects have been reported with the use of Kratom. We are going to talk about the evidence, and I also want to introduce you to one of the advocacy organizations related to this product, because I believe for all of you in the healthcare field, they may very well impact what happens with this particular product moving forward. In general, Kratom is one of, it's derived from a tropical tree that's found in Southeast Asia. Parts of the plant have been used for centuries as endogenous medicines in Southeast Asia. The fresh leaves are chewed or seeped into tea. Oftentimes it was used more as a stimulant, so something similar to coffee. It actually is very similar to the coffee plants. The dried leaves hadn't been used predominantly in the past, but with the incorporation and attention, as well as demand from Western countries, us being the main one, they really have looked a lot more at drying the leaves to utilize them for powders. The powders are put in capsules or provided as powder to be mixed into other drinks, and they also can be sprinkled into other things to be smoked. That was originally where it started coming in, but it's definitely pivoted away from the smoking more recently. So what is it? The Kratom plant actually contains more than 40 active compounds. More than half of them do appear to bind to the opioid receptor. So as a reminder, we have 3 opioid receptors: the mu receptor, the delta receptor, the kappa receptor. The vast majority of them do bind to the mu receptor. That's the receptor that's involved with pain control that we see with most of our other opioids. It also does quite a few other things. We'll talk about drug interactions later. It is activated by a number of our cytochrome P450 enzymes, and some of these indole alkaloids also are involved in potentially changing the activity of some of those enzymes. The mitragynine is considered to be the most prevalent compound. It's classified as an indole alkaloid. We have a lot of medications that come from that same type of chemical class. They tend to be used for mental health conditions. They've been approved for treatment of psychosis, for depression, for migraine treatment. So we have several that fall into this same family. Because not all of them have been associated with use in the opioid receptors, they did look for additional activity and they found it. So these particular compounds seem to be active at dopamine receptors, at noradrenergic receptors, specifically the alpha-2 receptor. That's going to be important for some of the potential reasons why people are using it. So keep that in mind. It works a lot like clonidine or lofexidine. And it also has some serotonin receptor activity, specifically 2A and 2C, although there is some discussion that there's at least moderate activity at the serotonin 7 receptor. So they're looking at it for cognition as well as potentially for involvement in mood disorders, anxiety, as well as psychosis. I do want to point out one thing related to its activity related to the opioid receptors. So despite the fact that it works on all three of the receptors, they're not actually sure exactly what it does. It originally was classified as an agonist for the mu opioid receptors. It has since then been reclassified as more of a partial agonist at the mu receptor. They believe it might be an antagonist at the delta receptor, and the jury's still out about what it does on the kappa receptor. Now, the other piece that's important, we have lots of opiate medications that are available. So what would make this different? There is a tremendous push to say that this is different on the mu receptors. What they've found when we attach to the mu receptor, they're G protein coupled receptors. So it's a relatively large receptor, and then lots of other things happen. It kicks off a cascade of additional activities. Of those additional activities, there tend to be 3 different classifications. One of those classifications is related to a compound called arrestin. So beta arrestin, there's 4 different types. We're going to focus just on beta 2, has more recently been associated with a lot of the adverse effects that we see with the use of opiates. The development of tolerance and dependence to opiate medications, as well as it seems to be associated with the development of respiratory depression, significant sedation, as well as constipation as a result of opiate use. These particular compounds do not appear to activate that arrestin system. So yes, they work on the opiate receptors, but there is a ton of interest in this area, specifically because it's not activating, and it may be actively inhibiting the arrestin pathways and those arrestin actions, which could mean a medication that works on the opioid receptor that is effective for pain management, but doesn't develop nearly as much tolerance, risk for respiratory depression, constipation, or sedation. That's all theoretical. It's been studied in a number of in vivo and preclinical trials looking at mice and rat models. I don't think we know enough about the details, but that tends to be one of the drivers for making sure that this particular product is widely available and justifying its use. So I thought that was an important part of the story. Historically, what kratom had been used for was improving circulation, extending the duration of sexual intercourse, gastrointestinal effects, so both constipation as well as diarrhea, opioid withdrawal symptoms, which I thought was interesting, that and pain are going to carry forward. So they had been used in the past for patients who had been on opium and were trying to transition off it and not having a lot of success. So that particular use of it had been relatively well established for quite some time before it made its way to the shores of the United States. For us here, despite the fact that it is out there and it is available, the Food and Drug Administration has not approved any prescription or over-the-counter drug product containing kratom or any of its main chemical components. So all of those 40 compounds, they haven't approved anything that specifically includes them. It is not officially to be marketed as a drug product, as a dietary supplement, or as a food additive. And that's pretty important because that means that it falls into a category that is not overseen right now by anybody. There are a number of places around the world that have limited the use, I was going to say outlawed, limited the use and declared illegal all of the kratom compounds because of concerns that they have. It was proposed to be made into a Schedule I substance. So Schedule I controlled substances are things similar to heroin. It's where marijuana used to be. So it's essentially the illicit drugs that are not able to be distributed anywhere. There was a massive grassroots opposition to that, which got it completely stopped in the legislative process. And that's why I think it's important to bring in the advocacy piece. So it is not controlled. It is not really marketed as anything in particular. It's really found a way to exist in more of this gray territory that's inconsistent across the country. So everything I'm saying is off label, just for the record. And I know that's the second time I said it, but I wanted to make sure that you're aware. So the fact that it falls into this weird gray territory, what does that mean? So despite the fact that there were places that allowed a lot of the use and did not necessarily outlaw it, it's been used by what was estimated to be about 2 million Americans who are the age of 12 or older. It was included in the last National Survey on Drug Use and Health to try to capture this, recognizing it has been a growing problem. And the thought is that's an underestimation. So despite the fact that it says it's under 2 million, there are other estimates that suggest that maybe it's closer to about 5. It is available in all kinds of things. You can Google them. You can look them up. You can go to the American Kratom Association because they have all of the manufacturers that are supporting that organization. So it is available as tinctures, as extracts, as powders that get mixed into other things, as capsules. It's made into tablets, it's teas. So it's available in a number of different ways. If you're wondering how that happens, to be honest, I'm not really sure. So there are some states that have put into effect legislation that specifically protect consumer access to these particular products. It's not a drug, it's not a supplement, it's not a dietary supplement, but it is available. So it's falling into this interesting category that's not overseen or regulated by anyone. So despite the fact that there are all of these products that are available, over the past 5 to 7 years, there have been reports of heavy metal in a number of the products, especially before it had more established legal grounds to be distributed, because it was mixed in other things like potpourri that were not technically for ingestion by humans. It also had salmonella contamination a few times. So there have been outbreaks of salmonella that's been traced back to patients who have used Kratom. Interestingly, there is now a push to have the FDA weigh in on Kratom and establish good manufacturing practices. They don't want them to police what it can do and what the side effects are, but they want them to be able to say, yes, these are safe, so that people feel more comfortable using them. So it really is a very unique situation and environment right now. So what is it being used for? It's available in all of those different compounds and dosage forms. Individuals report, most of these are taken from survey data. So from current Kratom users, what are you using it for? Anxiety, individuals use it for alertness or concentration. They say it's an energy supplement, that it makes them much more energetic, to have increased motivation, more drive. Some say it makes them feel more social, or that they want to engage in work. Some folks will use it for treatment of depression or insomnia, which is interesting. So low dose, it's a stimulant. Higher dose, it has more of those opioid activities. So they really would have to use a higher dose. That's why, even though it can help with alertness and as an energy supplement, you also see it for insomnia. And then those opioid withdrawal symptoms and pain that I spoiled earlier on, that are also being used for this currently. Interestingly, that tended to be one of the spaces that people were using Kratom for more prominently in the past, but the number of uses is diversifying relatively quickly. And because this is not controlled or overseen by anyone, many of the CEOs for the companies that create these products are doing interviews, they're doing marketing campaigns, and they often will make statements along the lines of, Kratom may be helpful for your sex drive. It might help with your concentration. If you have attention problems, maybe this could be helpful. So they really are looking to diversify what they're able to use this for. General stress is one of the big drivers right now that they're very much paying close attention to increase that market share. There were a handful of surveys that were done. I was able to pull 3 of them. There is not much in terms of clinical trial data. I will show you what I was able to uncover. It's not much, so please don't set your expectations too high. We've got 1. But there have been a lot of surveys done. Most of the clinical evidence at this point is supported by individuals who are proponents of Kratom. So I would like you to keep that in mind. The surveys are people who are using Kratom, and then they're like, well, what are you using it for and does it work? Well, if you're surveying people who use this and have been using it for a while, chances are they're going to say, yes, it does work. And that's what they're seeing. So in 2016, they did a survey of more than 8,000 individuals who were chronic Kratom users. 58% reported that they were doing self-treatment of a mental or emotional disorder, which may or may not have actually been diagnosed, but that was what they were using it for. And of that 58%, almost 2/3 of them said that they were in good or very good health. In 2017, there was a survey that was conducted. There were 661 individuals. And when they were looking at why are they using this, the primary indication was for management of opioid withdrawal symptoms. Pain management was also in there, but most of them were using it for the opioid withdrawal symptoms. In 2019, there was another survey that was conducted, again in chronic users, over 3,000 of them. The most common indication this time was for pain relief, but over 60% of the respondents said that they were using it for anxiety and depression. And I left myself an asterisk there as my reminder, because even though the most common reason that they were using it was for pain management, the anxiety and depression often came along with that pain management. If they had chronic pain, they're much more likely to have an anxiety or mood disorder. So it wasn't just standalone that they were doing it, but it had expanded some of its indications. So that's survey data in people who are using it. So people who are using it have sought it out independently. They're purchasing it out of pocket. So I wanted to see, do we have clinical data? It's like, can we prove that this is actually doing something? Because the pharmacology sounds really interesting, where it has potential, but does it actually work? There's not much. I was able to find 1 clinical trial that's been published. So this was a randomized, double-blind, placebo-controlled trial that was a pilot study. So this was conducted in Malaysia, and they screened patients who had been using Kratom chronically for a year. They ended up with 26 adults. They could not have any other substances present or any other type of mental health condition, but they were using Kratom chronically for a year. They were randomized to a handful of different groups. So there were 4 different groups. They had to spend the night in a hospital, and they measured concentrations of the mitragynine serially in these individuals. They also looked for withdrawal symptoms, and they gave them 3 different drinks. So they either got all placebo, or they got 1 Kratom drink and the other 2 were placebo drinks. Now, with that in mind, some of them got the Kratom drink first and then 2 placebo drinks. Some of them got a placebo, then the Kratom drink, then a placebo. Some of them got 2 placebos and then the Kratom drink. They did not really evaluate much other than the changes in concentration. As a shocker, the concentration for the Kratom people who got it first, their serum concentration went up and came down early. For those who got it second, their concentrations were low in those alkaloids, and then they peaked with the second administration. And then for those who got it last, theirs peaked at the end. But that really was the only evaluation they did of those 4 different ones. They really were looking at if they got Kratom or didn't get Kratom, what happened with their pain management. So their pain management was immersing the patient's hand in an ice bath. So they would put it in an ice bath. They had patients timed for how long that they could keep their hand in the ice bath. And then they also had them rate on a visual analog scale how uncomfortable or unpleasant that experience was. These are the results from those 2 trials. So on the top here, it's pain tolerance. So the number of seconds they were able to keep their hand in that ice bath. They had them do it before they were administered a drink. They had them do it an hour after they were administered a drink, and then again 2 hours later. What they found, so the open circles are the patients who were given Kratom. So they did have an active component. The closed circles are the placebo group. The 1 hour after the drink, there was a statistical difference between the 2 groups. Their pain tolerance, so they were able to last between the Kratom group could last for 11 seconds before they took any of the beverages. After an hour after they had taken a beverage that included Kratom, they were able to keep their hand in it for almost 25 seconds, which was significantly different than the placebo group. They were only able to do it for about 12 seconds, which is where they had been previous. But then by the 2-hour mark, they were back to about the 15-second. So they did see a statistical difference at that 1-hour time frame. When they looked at the unpleasantness, again, the open circles are the Kratom group. They did see that it was ranked as being less unpleasant at the 1-hour mark in the Kratom group compared to the placebo group. That coincides with being able to keep it in there for a longer period of time. What I do want to point out, though, is that it was in 26 individuals and the confidence interval was relatively large. So even though statistically there was a difference between the 2 groups, they're confident, they're 95% confidence intervals. So we're 95% sure the actual unpleasantness for patients that had placebo or Kratom falls within that range. They overlap. So that means that the pain scale for how long they could keep it in the water and the unpleasantness score could potentially be the same for the 2 of them. So even though statistically they found a difference, it really is unclear how robust of a difference that is. The hope is that they're going to use this pilot data to be able to justify additional clinical trials moving forward. I haven't seen too much. I tried to look and see if they've been doing other things, but it's not very searchable. It was conducted in Malaysia, and there is a little bit of a language barrier as I was looking for some of those clinical trials there. The authors did say that it was a substantial, significant, clinically relevant finding. I'm not sure it would go that far, but it does look like potentially it could be helpful, at least in the short term, for some pain management. So what else is available? There was a case report. So this was a 63-year-old male who has a history of major depressive disorder and generalized anxiety disorder. He had a number of other medical conditions, Meniere's disease, with pretty significant dizziness and tinnitus, alcohol use disorder, which was in remission, and he had previously had a myocardial infarction. He had tried a number of antidepressants with limited success and began using Kratom on the suggestion of a friend. So he had used it over the course of 7 years to try to control his depression and anxiety. His initial dose started with 3.8 grams of Kratom powder, and he was taking that approximately 2 to 3 times daily. It was reported that over the course of the 7 years, his dose continued to escalate because he found tolerance. So it wasn't as effective for his symptoms as it had been in the past. And it kind of came to a head where his symptoms increased. He continued to take Kratom almost on an hourly basis, and his symptoms would not abate and resulted in suicidal ideation, which resulted in hospitalization. At that point, he discontinued the Kratom, and did move to other alternative treatments for his depression and anxiety. So potentially useful, at least in the short term, but there may be some dependence, despite the fact that we didn't think, because it didn't activate that arrestin system, we were thinking that tolerance wasn't going to be an issue, but that may not be the whole story. So what else is available? There are a few systematic reviews that are out there that look at evidence related to Kratom. The vast majority are survey data in Kratom users. So I included them here. The first one was a cross-sectional survey. What are you using the Kratom for? Stamina for recreation. And the vast majority of them did report that they're unable to abstain from the Kratom. So again, suggesting that there's some degree of dependence. This second one was a retrospective review. It was looking at the phone calls over a 7-year time frame, starting in about I don't remember if it was 2015 or 2016, to poison control centers. And they said the vast majority of adverse effects that were reported in patients on Kratom were acute irritability and agitation. The same with the second one. So this was a smaller one. It was just looking at the poison control centers in Texas. They also had some patients who had confusion and hallucinations. The last two are both surveys. The first one was in Kratom users, what are you using it for? They were using it to improve relaxation, their mood, or as a substitute for opiates. The last one was a cross-sectional study, and they looked at patients who were using Kratom who were not using other substances, including alcohol. And then what was the frequency of having suicidal ideation? And they found that there wasn't an increase in suicidal ideation if they were using Kratom alone, as compared to some of the other substances. So I'm not sure how helpful most of that is. And this is a lot more of the same. So the two qualitative studies in people who are using it, how do you describe it? What are you using it for? Not really surprises there. The cross-sectional study, this was a cross-sectional study that was done in Thailand, and they looked at, so they surveyed over 1,000 patients, and they were asking them if they had withdrawal symptoms. So if you've been using it for a chronic basis, I think the threshold was 3 months. If you don't use it, do you report symptoms? And the answer was yes. And they went back and tried to classify that even more. And there are a number of withdrawal symptoms that have popped up. Because of that, they also did one in Malaysia and found the same thing. The individuals who have chronically been using do report both cravings as well as withdrawal. The last one was, again, a survey that was, what are you using this for? And as you can see, substitute for opioids, for opioid withdrawal, to increase energy and to increase sexual desire. So if that's what they're using it for, do we see side effects? Several have been reported. Unfortunately, with the survey data for individuals who are taking it, they tend not to report adverse effects, or they don't believe that it's due to the Kratom. They're believing that it's due to something else. So that does make it a little bit difficult. When we've looked at the poison control data and the FDA's warnings, there have been several that have been identified. So kidney and liver toxicity both have been identified. There have been some endocrine changes with both hypogonadism in individuals who have been taking it over a chronic period of time, especially starting in adolescence. There have been reports of cardiac arrhythmias, neonatal abstinence syndrome in babies whose mothers have been using it on a regular basis, respiratory easy for me to say, respiratory distress syndrome. So pulmonary symptoms, changes in cognitive status, so agitation, irritability, that can increase to seizures and coma. All of those have been reported in individuals with who have been using Kratom. The deaths at the bottom, I did put an asterisk next to. So all of the deaths that have been reported where Kratom has been a component, it has not been Kratom alone. So it's always been with other substances. So one of the advocacy claims is this is safe, it's everything else that's not. So it does make the picture a little bit muddy. I mentioned drug interactions. It is an enzyme inhibitor. So it is important to know whether or not a patient is taking Kratom, what they're taking, how much they're taking, because it does have the potential to interfere with the metabolism of other medications if they're on them. And there are a couple of considerations. I think this is important because this really is outside of the norm. There have been petitions against the scheduling of Kratom, against any type of restriction to Kratom use. And I had mentioned the contamination. So there's no way to prove that the products that are being purchased were manufactured under good manufacturing processes. So it really is a little bit of a risk for the folks who are using Kratom. If they can get one particular company or brand and do that consistently, that really would be the best case scenario. But a lot of this is being driven by the American Kratom Association. The American Kratom Association is supported significantly by every manufacturer of Kratom that I could find. So they really are funding this national organization, which has established a number of grassroots activities. They're lobbying Congress. They are promoting their own studies, again, using people who are already on the product and then promoting that to move things forward. They've been very successful. So they've been able to prevent it from getting scheduled. They've been able to reverse any type of restriction on that. And as of earlier this year, they now have 10 states that have passed what's called the Kratom Consumer Protections Act to prevent the state from doing any type of restriction on the availability of Kratom products. In 2018, Ohio was looking to have this on kind of a watch list, and they were successfully able to lobby the Board of Pharmacy and prevent that from happening. And now there's a Consumer Protections Act that's currently being considered in the active legislature this session to be able to ensure that it would be robustly available and protected for the individuals in Ohio. And this is how much progress they have made. So the blue are the states that have those protection acts in place. The green are where you're able to get Kratom. So they don't necessarily limit or restrict Kratom use anywhere. The yellow are interesting. There are cities in these states that have banned Kratom, but it's available in other places. So that's a little unique. We haven't come across that before. There are a few states that banned it outright. Those are the ones in red. And there are none currently that are proposing bans. They have been successful in shutting those down on a regular basis. The hope in some of the discussion, because I was snooping through their discussion boards, it is really to have Kratom follow the exact same path that marijuana has followed, to have it be medicinal but not regulated by the FDA, to have each state set its own regulations, and ultimately then to make it recreational so that it would be robustly available. So it's a super interesting topic. The way that this has unfolded is very different, and there are a lot of entities and audiences that are watching this pretty intensely. We don't have a lot of data, despite the fact they're using this for pain and opioid withdrawal management. It works like clonidine, so it makes sense that that might be helpful for it. We don't have proof that it actually works or that it's even better than what we have available. And we don't have a good handle on what that safety looks like. In addition to that, just being able to get the product does carry its own risks, and that's something that patients really should be aware of. So with that, I will stop my share and turn things back over